Welcome back. We want to go back out to Boaz for a few minutes now.
We are joined now by nurse practitioner Ashley Lackey from the United Doctors Family Medical Center. Thank you for coming on the show this evening, and thank you for your service. You and your coworkers are really on the front lines of this.
Yes, we are, and thank you so much for having me.
So moving forward, do you and your staff have all the personal protective equipment they need to continue to stay safe, and what could you use more of?
We have everything we need right now. Our first priority is, of course, keeping our staff safe. Without our staff, we can't continue to do what we're doing. You know, in the future, I can foresee we're going to need possibly some more gowns, maybe some masks. We have plenty of gloves and the other things, you know, that we need right now, but we are going to need some additional PPE in the future.
For a couple of weeks now, Marshall County's been considered the hot spot here in North Alabama. What do you think it's going to take to get those numbers down in Marshall County?
Number one, just continuing to test, and that's what we're doing. We're trying to test as many people as we possibly can so that we can identify those people and have those people quarantined at home, you know, away from their families, away from their jobs, away from being able to spread this further. We're trying to really locate those trends and those places where there's a lot of positives and get the information back to those people very quickly so that they can get out of those situations where they're near their employers or other people in the community and get them home and hopefully better.
Mm-hmm.
How are you and the other local nurses doing from a mental health perspective right now with everything you're dealing with on a daily basis?
I mean, it's tough. It's very tough to be outside in a tent. It's cold, it's hot sometimes. You have all that equipment on. And I think the thing that gets you through is, you know, just thinking about the fact that this is something that, you know, when you grew up, you wanted to do. It's something that brings peace in your heart, feeling like you're really giving back to the community and helping people. And just knowing that ultimately you're protecting your family because you're doing this for the community, and that gets you through these long, hard days. And, you know, we're just so happy at United Doctors to be able to help in any way possible.
Of those patients who have been admitted to the hospital, how serious are their symptoms? And in your estimation, what's the recovery rate?
The recovery rate here has been pretty good. We have had some that have been pretty serious in the hospital, but we've been able to recover those. There have been a few that we have not been able to. And of course, as you know, there's not any standard treatment for this. So it's just, we're basically just going off of guidelines that we're getting from other places and doing the best we can to try to treat, you know, with whatever we can possibly use, and hope that, you know, these people are strong enough and their immune systems are strong enough to pull them through.
Well, Ashley, what you do is truly a labor of love, and thank you so much for you and your coworkers and all of your life-saving work.
Thank you.
Just